Hello there. Welcome to my show, COVID-19 update by Heerak for January 3rd, 2021. Yeah, so we went from 20 to 21. Um, Today is JRR Token Day, January 3rd. My precious, my precious. Remember that movie? If you haven't seen that movie, you should see it. JRR Tolkien movie. Yeah, precious. One of the great things about campaigning for U.S. Congress, as you know, I'm a candidate for U.S. Congress in Virginia's 8th District, which includes Arlington, Alexandria, Falls Church, and parts of Fairfax County, is meeting a lot of nice and interesting people. Um, And so this is from 1 year ago before everybody was required to wear a mask. Um, it was fun, campaigning, and it was obviously around Christmas time, as you can see. And this was in Fairfax County. I campaigned quite a bit in Fairfax County as well. And so, people like me, and, they were interested in kind of talking and getting to know me as a candidate for U.S. Congress. Not everybody, agreed with me or, you know, but they were open to voting for me or getting to know me better, which was good. Um, yeah, I met a lot of interesting people. There are a lot of people who do a lot of interesting things in Fairfax County. And there are people who do really important things in Fairfax County, like the volunteer fire chief there. Yeah, I mean, he's, volunteering and fighting fires in Fairfax. Um, and obviously, everybody contributes in some way to the life in Fairfax, like these individuals who sell things. So, yeah, I mean, yeah, I mean, this is still New Year's weekend, so everybody's in a holiday mode, slow, and that's why not all the numbers are in. Obviously, we have more than 1,520 deaths in 24 hours, but it's holiday weekend, New Year's weekend, so people partied it up on New Year's Eve, New Year's Day, and they're kind of taking it slow and kind of spending time with their friends and loved ones this whole weekend. And yeah. So as you know, I'm running again for U.S. Congress for year 2022 on November 8th. I saw some people getting sworn in today in U.S. Congress. So that'll be me 2 years from now. you know, I'm calling the next 2 years COVID-19 campaign years. Um, since we're going to have COVID-19 from the beginning of the campaign or beginning of the election cycle to the end of the election cycle, 2 years of COVID-19. So, yeah, 2 years of COVID-19 campaigning, COVID-19 election years, Um, yeah, it's gonna, I mean, it already has changed everything and how we do things. And so it's going to be very different next 2 years as well. This COVID-19 is here to stay. As far as we can see, it's a 365 days a year virus. So it's not going to go away. Uh, so that's a sad thing, But obviously, as humans, we adapt to our environment. I'm an immigrant from South Korea. So after I immigrated from South Korea, not knowing English, not knowing American culture, I had to adapt. And my parents are older and they had to adapt. So, as an immigrant, I understand the concept of adaptation. Some things are vastly different. Um, in COVID-19, America is similar in that sense. I mean, COVID-19 is here to stay. Uh, Although we did not immigrate, it's kind of like COVID-19 descended upon us. Now we have to adapt to COVID-19. or face possible infection and death. So yeah, it's just fact of life here in America right now. So we have 351,453 people who are confirmed dead from COVID. Um, that's a lot. And we have 20,630,543 people who are confirmed cases. They're known to have COVID. Um, and by a lab test. Um, but we're not alone among people around the world who are dying in large numbers. Latin America, which I'm calling continent of death, has a lot of COVID-19 cases and deaths. So Brazil has 7,733,746 cases, 196,018 deaths. So they're basically at around 200,000 deaths. Colombia is number two in Latin America with 1,675,820 cases and 43,965 deaths. So yeah, it's not a small number. Argentina has 1,640,718 cases and 443,482 deaths. So all of them are 3%, top three. Death rate is probably going to increase. Mexico has 1,448,755 cases and 127,213 deaths, so 9% death rate. And Peru has 1,018,099 cases, and death are at 37,773, 4% death rate. Yeah, things are bad in Latin America, and it's about to get worse because it's winter time. It's really sad. Um, so you know, we're in New Year's holiday weekend, so a lot of people are flying, and I'm sure a lot of people flew today too. Some are flying back home from vacation spots, and I have to confess I'm really worried because a lot of people have gone somewhere for vacation, uh, or to visit families, or you know, just traveling for whatever reason, and now they're back in this area. We see when I saw a lot of U.S. congressmen being sworn in or standing in line to be sworn in, I realized that all of them, probably most of them or all of them, flew in from somewhere, right, another state, and they have staffers who probably flew in with them or flew in separately but are now in this area. What that means, from all 50 states, we have COVID-19 cases spreading and coming to DC. So that can be very tragic for this area. As you know, I live in Arlington, Virginia, which is, it borders DC, Washington, DC. So when all these US House of Representative members are coming to DC from all over America, they're bringing with them COVID-19 different variants from all over America, and their staffers as well. So that's going to be pretty bad for DC area. But they're not the only ones traveling in New Year's weekend. Obviously, there are people from Virginia, Washington, D.C., Maryland who travel home because either they're going to school here or they're working here. They travel home for Christmas or New Year's and are coming back. There are also people who live in Virginia, Washington, D.C., and Maryland who visited their grandparents or their friends in other states, and they're coming back. And of course, there are people who like to vacation. So maybe they went to another country for vacation. Maybe they went skiing in Utah, or another state. Maybe they went to Nevada to party it up for New Year's weekend. Um, these people are going to be flying back to DC, Maryland, and Virginia. Many of them are flying back today, Sunday, because they might have taken Christmas vacation, New Year's vacation, several days off, but now their work starts, next week. And so there's a lot of worry about what will happen next week in your workplaces. People flying in from other states or hotspots who don't quarantine for 14 days, they can have COVID and they can spread it. So we are already at 5,000 cases per day in Virginia, 5,000 cases per day. At flu season, 10% death rate. That's like 500 people dying every day in Virginia. I mean, they're not going to die right away. Obviously, it takes them time to get sicker and then die. But we're having 5,000 cases per day now. And now all these people are going to come back from New Year's Day celebration. We can easily go to 6,000, 7,000, 8,000, 9,000, 10,000. And if you work in a physical place, whether you work at McDonald's, with other coworkers, or whether you work at a hospital with other coworkers, your coworkers who traveled outside of the state for vacation or visiting family who are coming back, they can be bringing COVID-19 back. And if they're on quarantine for 14 days, it's a very high risk. So every hospital in this area, Virginia Hospital Center, Innova Fairfax Hospital, Trauma One, Innova Alexandria Hospital, MedStar Georgetown Hospital, MedStar Washington Hospital Center, Children's National Hospital, Sibley Hospital in DC, Suburban Hospital in Maryland, Montgomery County, and Adventist Hospital in Shady Grove. These are all facing dangers, not only from patients who have traveled and are admitted, so they may be negative, uh, but they could be positive a few days later if they got infected on the flight over and, from a family vacation or travel. They could be negative, but they could test positive a few days later. Um, so you have several cases like this where patients are testing negative, admitted to the hospital, but they're actually positive and they become positive like a day later or 2 days later, who can infect people who are working in hospitals like nurses or doctors, respiratory therapists, physical therapists, occupational therapists. This could happen in every hospital in this area and every hospital throughout the country. Um, so patients can give you COVID. Visitors who are visiting their family members can give you COVID as well. If they've been outside of the country or out of the state. And there's 5,000 new cases in Virginia every day right now. So even if they didn't leave the state, they could have COVID and bring it with them, and then give it to their own family member who may be a patient in the hospital, or to nurses, doctors, respiratory therapists, physical therapists, occupational therapists, uh, you know, food services, patient care technicians, CNAs, certified nursing assistants. So a lot of people are going to get COVID in every hospital in this area. And those are only just two possible uh, chain of transmission. Obviously, you can get COVID from your coworkers. If your coworkers travel outside of the state or outside of the country, and they're not self-quarantining, they may be carriers, they may have COVID and get it from them. So it's a serious situation right now. And I guess next week, 2 weeks to 4 weeks will show us what that means. If Virginia's COVID-19 cases go up to 10,000 within 1 or 2 weeks, then obviously we realized there should have been a law to make sure people quarantine after travel for 14 days. Governor Northam hasn't issued that order, so everybody's vulnerable because nobody knows who traveled and who did not. And there's no rule that they have to quarantine, right? So there's a serious problem right now, and not everybody's traveling by plane. Obviously, plane travel is the most dangerous, but travel by car to other states, train, buses, and so next week, next several days are going to be critical because we're going to see trickling in of people who got infected over the vacation. You know, so tomorrow, Monday, Tuesday, Wednesday, we're going to see a lot of cases of COVID rushing into hospitals, and so yeah, and it's going to get worse throughout the week, and so that's something that I think most nurses understand can happen. And so this week is going to be a critical week. It's a post Christmas holiday, New Year's holiday week. A lot of people are coming back home from wherever they were. Yeah. Yeah, you're listening to Zauberflöte, Magic Flute by Mozart. It's an opera. Um, and there's a talking part. So, and it's a German play, right? So it's in German. Zauberflöte, Magic Flute, written by Mozart. Some of you might have flown to German-speaking countries, or German-speaking areas, like Switzerland or whatever. Um, so so next few days are going to be critical. Like tomorrow, Monday, is going to be a scary day for many people who are working because a lot of people who came back from vacation who work may be bringing their COVID with them to their workplace, to the school, like children who traveled. Teachers can get infected from them and die. So tomorrow is going to be critical, and there's bound to be a lot of activity in hospitals, especially emergency rooms. Um, and I guess most nurses will be kind of nervous because when visitors come to visit, they may be carrying COVID from their vacations. Um, and patients who are admitted may be infected with COVID, but they test negative, but they may actually have it, and they can, several days later, they may test positive. Um, so there are a lot of people who are probably worrying: nurses, respiratory therapists, physical therapists, occupational therapists, doctors, patient care technicians, or certified nursing assistants. Um, so I would say, this week will be nerve-wracking week for everyone, especially people who are aware of the dangers, like nurses and doctors. I mean, 5,000 people are getting COVID in Virginia right now every day, and we can go to 10,000 relatively quickly. So it's a serious situation right now. Let's read the three articles. First article is, so the title of this today's set of articles is New Year Travel Spikes COVID. First article title is U.S. air travel hits pandemic high, adding to fears of yet more case surges and the new variant. Remember, there are new variants from the United Kingdom, which is different from a new variant from South Africa, which are spreading around the world right now. So this is by staff in New York Times for today, January 3rd. This is also the first holiday period in which the new, more transmissible variant of the virus, first found in Britain, was known to be circulating in the United States. Although air travel is down markedly from years past, American airports had their busiest day of the pandemic on Saturday with 1,192,881 passengers passing through security checkpoints, according to the Transportation Security Administration. Since December 18th, the agency has counted more than 16.3 million trips through its airport checkpoints, down from more than 35.4 million in the same period a year ago. So about 50 or maybe 45% are traveling, about half are traveling, but still it's a lot. Um, and tens of millions more people are expected to travel by car. So there's a lot of traveling right now, and that's always bad for COVID. Uh, because people bring COVID from other areas, other variants, this area, or your area. Second article, Americans have been escaping to Mexico to avoid COVID-19 restrictions back home. Because there are a lot of states with restrictions. Uh, so a lot of Americans with money are flying to countries without restrictions. Um, and so, actually they're bringing America's COVID to other countries. We're exporting COVID in this case. So now Mexico is seeing a surge in coronavirus cases. A lot of Americans are vacationing in Mexico, bringing COVID-19 with them, and they're giving that to Mexico. This is people-to-people transmission. So this article is by Joshua Zitzer in Business Insider. And important excerpt from the article is, in a bid to avoid COVID-19 restrictions back home, a considerable number of Americans have traveled to Mexico for a vacation, or in some instances to settle down there. According to the Times, the number of U.S. visitors entering Mexico doubled between June and August 2020 during summer, and in November, more than 500,000 Americans traveled to Mexico. And on December 31st, 1,052 people in Mexico died of COVID-19, Worldometer reported. So a lot of Mexicans are dying, like thousands are dying a day. On December 31. It's going to continue. So Mexico is expecting a lot of that, which is really sad. Uh, yeah, but that's expected, unfortunately. The German music is great, like Mozart, Beethoven, Bach. Yeah, I like classical music, so especially Mozart. Um, Mozart's operas are great. If you haven't seen a Mozart's opera, you should see it. Oh, because of COVID, you probably won't be able to see an opera live anymore, unfortunately. But you can always like watch it on video. Uh, it's not the same, that's true. But so you opera lovers out there must be suffering quite a bit, you know. I love music. I love operas. I love classical music. Um, yes, I miss going to Kennedy Center to see an opera. But oh well, what can you do? Hey Ying! Uh, I invited Ying and her husband to go see an opera with me. So we had a fun time seeing an opera. Um, yeah, so a third article is Australian states reimpose travel restrictions to prevent spread of COVID-19. Um, Obviously, there's traveling everywhere. Some countries are restricting travel because let's say you have COVID-19 restrictions in New York. Um, but New Yorkers can travel, fly out, and then to areas there's no restriction, and then bring back COVID to New York. So some countries are worried about that. So they impose restrictions on travel to flatten the curve or keep the cases down. So Australian states reimpose, so they imposed travel restrictions, then they kind of loosened it up. They realized they're in danger of getting COVID spikes. So they are reintroducing restrictions. So Australian states reimpose travel restrictions to prevent spread of COVID-19. That's on Fox 59 staff. So I think Rudolph Murdoch is from Australia, isn't he? So the owner of Fox, I guess he's the owner, right? Yeah, so let's read important portions of that. More Australian states and territories are reimposing travel restrictions to prevent spread of the coronavirus from new outbreaks in South Wales and Victoria states. Because you can flatten the curve, but you can start a new outbreak. That's the scary thing about COVID. Even if you completely flatten the curve and there's zero cases and zero death, you can have new outbreaks that could like become a contagion. Um, and that's the scary thing about COVID. So that's what Australia is afraid of. Um, so Australian Capital Territory has shut out non-residents who have been on the northern beaches of Sydney, where the outbreaks are most concentrated. Greater Sydney and other smaller centers, unless they have an exemption. Victoria reported 3 new cases of community transmission on Sunday, down from Saturday's 10. So they're talking about single-digit infections, right, in these areas. But they're still afraid because one person can infect 1,000, and each of the 1,000 can infect 1,000 each. You see how? So obviously, even if you only have 10 cases, you want to quarantine and contact trace and make sure they don't spread it. Because one person can spread it to like 1,000 people over the course of so many days, several days. So yeah, I mean, so that's something that governors and mayors should think about, because you get a restriction for your own city or your own state, like in New York State for Governor Cuomo. But if your state residents travel during COVID, then a lot of people can die. This is one of the reasons why I encourage all the colleges to shut down campus and go 100% online because of this factor. Um, and unfortunately, colleges did not listen to my advice. And now that's why we have all these cases and death. We have we're averaging thousands of COVID deaths every day right now. And it's going to increase in January. But it started to spike in September when colleges open. And so, it's a tragic chapter in our nation's history that we're looking at, where COVID-19 cases are spreading because public schools are open and colleges are open. So these two sectors have to be shut down. Because remember, for public schools, the children go back home. So they could infect their parents when they go back home. But their parents, if they have COVID, they can bring the COVID from their parents to the schools and infect other children. So that's every day. You see what a risk that is? That's why we gotta shut down all the schools to physical learning and go 100% remote. Uh, Especially pre-K to 12th grade. because they have to go from school to home every day. And that's dangerous in the time of COVID-19. So, in a sense, we make our own luck. And by opening schools and colleges, we are creating our own bad luck. And that's the tragedy right now. And obviously, nurses will have to treat you. A lot of nurses are going to die. Uh, because even N95 mask that you wear is only 95% effective. There's 5% chance you could get COVID while wearing that mask. So a lot of nurses are going to die. I'm predicting dozens of nurses will die in every hospital. Dozens of nurses will die in Virginia Hospital Center. Dozens of nurses will die in Innova Fairfax Hospital. Dozens of nurses will die in Innova Alexandria Hospital. Dozens of nurses will die in Children's National Hospital. Dozens of nurses will die in Georgetown MedStar Hospital. Dozens of nurses will die in MedStar Washington Hospital Center. Dozens of nurses will die in Sibley Hospital. Dozens of nurses will die in Suburban Hospital in Maryland. Dozens of nurses will die in Adventist Hospital. Dozens of nurses will die in St. Mary's Hospital. We're going to have a lot of nurses die in the next few months. That's why I want to do a cheer for Georgetown fellow classmates, the 2-year Masters of Clinical Nurse Leader program. Because I know some of them will die. I mean, that's expected. I mean, unfortunately, you're going to have people die. Obviously, I don't want any one of them to die, but people are going to die. And that's the sad tragedy. So I want to say CNL 2020. Yay! We graduated from Georgetown. Even if we die in year 2021, we can say we graduated in 2020. So yeah, I mean, I wish I could give you better news, but we'll have to be realistic. You can only survive when you are realistic. Um, yeah, so I do want to wish you a happy 2021. We're on day 3 of 2021, but I'm calling year 2021 the year of COVID-19 deaths. We're going to have a tremendous number of deaths. We're going to have thousands of people die every day for 365 days a year. So yeah, that's what we're looking at right now. Dr. Fauci agrees with me, I'm sure. Every scientist, they have to agree to that statement because it's happening right now. Thousands are dying every day right now. So that's the sad part. I will bring you more helpful information tomorrow to help you survive COVID-19, but just be aware, 2021 is going to be year of COVID-19 death. I know some of you understand that, and that's why you want to spend as much time having fun, because you feel like if you're going to die in 2021, you want to have fun before you die. I mean, I understand that sentiment as well. Obviously, the smartest thing is to isolate yourself so you don't die. Not everybody's dying, right? Only less than 10% of Americans are infected with COVID. So, you can maneuver yourself so you don't get infected. You see what I'm saying? So, I mean, you could choose life or you could choose fun, but it's hard to have both. If you live in a city, especially because there's a lot of COVID in the cities. Yeah. So you gotta choose, do you want life, liberty, or pursuit of happiness? You can't have all both. I mean, when there's no COVID, you can have all three. But when there's COVID, you cannot have life, liberty, and pursuit of happiness, all three of them in equal part. So you have to choose which one is most important to you, life or liberty or pursuit of happiness. So Yeah, obviously you gotta make your own choice for your own life. It's your life. You're not a slave. You do what you want. But I'm just pointing out the obvious, uh, what the situation is. So yeah, I hope you think seriously about your life in the year 2021. You need to decide. Don't just be pushed by history. Decide for your own self what you want in 2021. Life, liberty, or pursuit of happiness. What is the most important to you? I hope that this show provided you with a thinking moment, because it's important for you to think and consider different factors in order for you to survive COVID-19. In order for you to help your children survive COVID-19. So, in a sense, this show is a public service, public health service to you and your children, to you and your family. And obviously, I'm targeting Virginia's 8th district, but obviously, this show is global, so everybody can see it and can benefit from it. I hope that you will think about your own situation, your children's situation, make decisions accordingly. It is a global pandemic. It is infecting a lot of people. It is killing thousands every day in America alone. Um, yeah. So I hope that you will reflect and think about your family and COVID-19 in the year 2021. And maybe you could make New Year's resolution that kind of reflects the reality that your family is facing. I hope that this show helped you uh, kind of think about you and your family in year 2021. You have to be realistic in order to survive, and this show is very important from that angle, right? As you know, I don't believe in the liberal media, uh, and liberal media tries to make it sound like you get vaccinated and then life is going to return to normal. It's ridiculous. It's I mean, you know what I mean? It's you gotta be a little bit more adult about it than that. Life is not going to get back to normal, even if vaccines work. And there's a high doubt as to whether they work because of all these variants and mutations. There are a lot of strains that have not been identified yet, which can infect people even if they have working vaccine that blocks certain strains out. It may not block other strains. You see what I'm saying? Um, yeah. So you need to think seriously about your family and what the best ways are to protect your children from COVID-19 infection and death. And I'm going to provide you with more and more helpful information you need. So check back every day, watch it every day, so you can survive COVID-19. So we're looking at like 365 days of year 2021, where you have to make conscious decision to survive COVID-19. And we're in day 3 right now. So we have 362 days to go in the year 2021. Um, yeah. Well, anyway, I hope that you will be well and that your family will be well too. See you tomorrow. Bye.